Our lab studies the immunology of infectious diseases. And so when COVID-19 occurred, we were in a unique position to be able to respond, because this is sort of what we do, is look at how the immune system protects against infections. Specifically, as far as like a COVID vaccine, what we've been doing is developing a vaccine against a parasitic infection, but it's a platform with which one can use to develop vaccines against COVID-19. And so what our research efforts are in the lab is to develop what might be a second or third generation vaccines. So there's two unique contributions that we're making to COVID-19 research through this lab. And so the first is the work of Ali Donlan, who's a graduate student, who has shown that an allergic immune response, what we call a type 2 immune response, actually predisposes to severe disease. And Ali's been able to show that if you neutralize that type 2 immune response, you actually protect an animal from COVID-19. Suggests that we should be able to protect people by neutralizing allergic cytokines.
We've seen both in the patient samples and the mouse data that the immune response to the disease itself is very variable. And so if we can understand what causes these variations in the host immune response or the host response in general, we might be able to tailor specific personalized medicine than, say, one size fits all medication.
The second advance is that Mayuresh Abhyankar, who's an assistant professor in the group, has shown that there's an adjuvant, something you add to a vaccine that will promote a long-lived antibody response.
What we have shown is the immune response lasted for at least 6 months using our adjuvant system. So that's pretty promising. And I think that's one of the exciting aspects we want to apply this platform for the COVID vaccine.
There is now 5 vaccines in the U.S. that are in phase 3 clinical trials. I'm really optimistic, and I fully expect that healthcare providers will be vaccinated probably like the end of this year, January, and then we'll go to then vaccinating people who have underlying illnesses that put them at greatest risk. And then finally, we'll be to the general public, I would imagine, by spring, summer of next year, and so the vaccine will be widely available to everyone.